Hi, Ken. Thank you so much for joining me today. Happy Wednesday.
Yeah, happy Wednesday to you too as well. Glad to be here. Thank you.
Absolutely. So, before we get started, I wanted to take a quick second to thank you again for joining us and chat about Medicare. When it comes to healthcare costs in retirement, a lot of people underestimate just how much of an obligation these costs are on your retirement savings. Care to share your thoughts on this?
Oh yeah, absolutely. The thing about making it to the finish line, getting to retirement, this picture in our mind is that we're gonna be on the front porch in a rocking chair, walking the sandy beaches, and traveling and relaxing, and it's a good time. We've earned that opportunity, and so on. But what often is forgotten is the cost of healthcare. And the amount of money that can be spent on healthcare and retirement. Yeah, that's what we're going to get into today.
Beautiful. So, do you have any perspective on what someone can expect to spend on healthcare in retirement?
Well, yeah, studies have been done on that, and the costs are significant. They may surprise many people. Generally, I'll cite a study that was done by Fidelity and the retiree health care estimate for a 65-year-old couple. So for two people, 65 years of age in retirement, the average number is north of $300,000 in costs in retirement. So what does that mean, really? Well, some people may be less, depending on health and how long they live and so on. And then, of course, others may spend more. So that's what averages are all about. But the main criteria here is what is the plan for taking care of these costs in retirement. Luckily, of course, when we do make age 65, then we've got this thing called Medicare. And so, and that's a help. Absolutely. We've worked, entire lifetime of work and all those years we put in and contributing to the program. And now it's time to tap in. The downside is, of course, that the system is complicated. There's a lot to it.
Absolutely.
And sometimes it can be very difficult to navigate by yourself. So that's the downside.
Absolutely. Well, you said north of 300. That's a very sobering number to hear. And I'm sure I'm not the only one who feels that way. But I also feel that it's good to know that the Medicare system can help us offset some of these costs. You also mentioned that Medicare can be difficult to navigate on your own, which I agree 100%. Can you make sense of it all?
Yeah. So the basic thing about Medicare is they have some basic breakdowns. So they got four main parts that I'll talk about and just kind of walk through the basics of these four main parts. So they're Medicare A, B, C, and D. They're all different. They all have unique services, different coverages, but it can be easily confusing because of that.
Yeah.
All right. So when we think of Medicare Part A, that is hospital insurance, and it helps cover inpatient care in hospitals. Okay, so we need to be admitted to the hospital or skilled nursing facility, a hospice care, and it does include home health care. Okay, so that's Part A. Again, what it covers is inpatient in hospitals, skilled nursing, hospice care, and home health care. So then we move on to Part B. And so this is medical insurance, and it helps cover the services of doctors. Okay, well, and other service providers as well, but principally doctors. And outpatient care, medical equipment, and preventive cares like screenings and shots and vaccines and so on. So that's Part B in medical insurance that helps covers the services of doctors, other healthcare providers, outpatient care, medical equipment, and preventive care, like screenings, shots, vaccines, and so on. So that's A and B, two pretty core areas then. Then we go into C, which is also known as Medicare Advantage. Okay, so Medicare Advantage, and it provides coverage for everything found in Part A. Okay, so Medicare Advantage, all of Part A and Part B through one plan provided by a private insurer. Okay, so that's an important distinction now. We've gone from the government program to a private insurer here in Part C, and that's called Medicare Advantage. Part D is a separate Medicare drug plan that covers the cost of prescription drugs. And so, including many shots and vaccines and so on. So that's what A, B, C, and D is, kind of the core of the Medicare program.
Yeah, that's certainly a very complex system, but the breakdown was very helpful. So I appreciate that. I can only imagine trying to figure that information out on your own. And honestly, it might lead people to find misinformation. Are there any common misconceptions or myths that you come across?
Oh yeah, there certainly are. And so what happens is that we want to begin to tap into professionals that can help us to understand the Medicare program. And we'll talk about this at the end of the show today, but we have a webinar this evening, and that webinar is put on by our go-to guy here in Brevard County. He is a licensed professional. He understands Medicare very, very well, and also does represent the supplement programs as well. So when we get into that, we'll be able to chat about that a little bit. So let's get into those myths, and as we get into Q&A this evening during the webinar, then you can start to dispel some of those myths. But so here's probably the key one to remember is that the misconception that Medicare covers all healthcare costs. It just doesn't. Okay, well, that would be ideal if it would, but it doesn't cover all those costs. So Medicare A and B cover a decent amount of healthcare costs. What it doesn't cover is things like dental, vision, hearing, and some specialized costs. Well, what would a specialized cost be? Well, transportation to and from the doctor, as an example, is a good way to think about that. Okay, so since these aren't covered, of course, that's going to be out-of-pocket costs. So there are some Medicare Advantage plans that cover some of those services. So remember, Part C is a Medicare Advantage plan. So some of those do have those kinds of services. And you really want to talk to someone that understands those plans very well and what the options are there. So that's myth number one. It doesn't cover all the costs, but you may be able to shape those plans and coordinate them to help offset those costs. Okay, so on to myth number two. Medicare is free. Okay. Well, first of all, let me just take a step back. We have really earned Medicare.
Yeah.
Okay. Because all these contributions over all these years put us in a position to where that Medicare program has been funded.
Yes.
And I'll just do a quick sidebar. Of course, there's a lot of discern between the political parties, and we should change these programs and need to be modified and so on. That probably isn't going to happen in this cycle. Right. They're much more concerned about the midterm elections and things like that to take on and tackle this kind of subject, right? Now, Medicare is not free, okay? We have paid a lot for it, and so that by itself makes it not free. But the other thing is that as we go through the program, we'll find that there are additional costs, all right? Medicare Part B. So I'm going to start with B here. You may pay, okay, most likely will pay premiums, deductibles, co-pays, and co-insurances out of pocket, just like you would with any other health care plan. All right, so we want to pay attention to those in our analysis on what we feel is going to be right for us. Right? So that's Part B. And with Part A, you may qualify for little or no premium, okay? But you still have a deductible. You have a copay, co-insurance. And so again, there's a difference in the premium, but there are additional costs in the form of copays and co-insurances. Medicare Part C may offer a little or no premium. Okay, so this can be attractive for some, little or no premiums, but they also include other costs as well. And Mike will get into that this evening. And then, of course, with D, you may have a premium for that as well. Okay, so the common here is, what is the premium? What do I pay in addition to all those contributions through all those years that I have qualified once I get to age 65 for? Fair enough. So that's myth number two. It is not free. Now, myth number 3 is really kind of top of the mind awareness for right now, isn't it? Okay, because that is the myth that you can sign up anytime you want to. All right. So there are specific time frames for you to sign up and alter your plan. Those that are turning 65. Okay, 3 months prior to your birthday, 65, up to 7 months after is that time frame for you to sign up. And you want to sign up. There are repercussions if you don't. All right. So that's our message there during that time. And then, of course, each year there is a time frame that we're able to go in and alter an existing plan. And that time frame is from October 15th to December 7th, Pearl Harbor Day. I always remember that every year, Pearl Harbor Day.
Awesome.
So that allows you to join, drop the plan, alter the plan, do that type of thing. Fair enough? So those are really the key 3 myths that are associated with that. So, and that covers a lot of ground. There's a lot to that.
Definitely. So after hearing about all these different moving parts on top of the myths and misconceptions, I can see how somebody could be confused and potentially frustrated while trying to navigate the Medicare system without professional guidance. So you talked about an event that you are hosting tonight. And I just feel that this is so important for people who are currently enrolled in Medicare or are planning on to attend, to even review your current plan to see if there's been any changes for this year to next year, and so on and so forth. So would you like to share anything with those out there who are considering how they'll address these costs in retirement?
Yeah, absolutely. So this is a coordinated effort. So there are costs associated with healthcare. How are we going to cover those costs in healthcare? And so the part the financial advisor plays is to bring this to the forefront. It is part of the income statement for all clients. In other words, it's a cost item. And it also affects the balance sheet because it could be assets that are necessary to pay for things that are not covered. And, let's face it, for the vast majority of people, there would be more healthcare costs in retirement as we're growing older than there typically is during our working years. And during our working years, we may have company-sponsored health plans, and, they've evolved over the years. So the first part really is to become aware of what the risk is and what those costs are. The second thing really is to really position and coordinate the use of Medicare and how it would integrate with your financial plan, your cash flow plan, which we call technically an income statement. Okay, what is it costing us? And then, of course, the assets, are they positioned properly to help? And we've covered a lot of costs here in terms of typical medical costs. Doctors, hospitals, nurses, procedures, and so on. And we've really kind of left to the side the long-term care costs. And so that goes hand in hand with Medicare, because that would be just another myth associated with Medicare, that it would cover long-term care costs. Well, then we start to get into the types of healthcare that can be provided. So skilled care, a lot of which is covered by Medicare. And that's what the whole topic is here. But there are other costs, especially the long-term care costs, the activities of daily living that really have very little, if any, help from Medicare for the typical client there. So really, the thing about it is to become aware of healthcare costs in general, how they're going to be provided for. And this segment really is talking about Medicare, how to integrate it, how to use it to your best advantage, and really get something out of all those dollars that have been contributed to the system for all these years. So this program this evening will be recorded, so we'll be able to pass it along to others. But I highly suggest to get on board with it. We'll be able to do some Q&A and then certainly phone calls with skilled professionals. That's the key theme, is someone who completely understands the Medicare program, the nuances. And you know what? Once you get to know it, next year it'll change.
Absolutely.
And then we'll have some political intervention, and then it'll change again. And so we always want to be aware of all these things that are probable to happen with the plan that we have in place.
Most definitely. Well, thank you so much for joining me again.
Absolutely.
And if you want more information regarding tonight's event, contact the office. Jenny will be more than happy to give out that information. I think it's a very important event to attend to. Like I said, if you're already enrolled in Medicare or are in the process of, it's important information to know.
Yeah, absolutely. Specifically, Jenny will send out an email link. You can just get on your computer at your leisure. You can hit it and then and look at it, and that'll also get you in a position where you can get a copy of the recorded. And then, of course, there'll be a Q&A, so we'll be able to get into specific questions as well. So that's tonight at 6 o'clock Eastern Time.
Perfect. And for everyone watching, make sure you comment, like, and share this video so the information can be spread to others. Ken, once again, it's always a pleasure. Thank you so much for taking the time.
Sure. Thanks for hosting for the show. I think it's important information. So thanks a lot. Till next time.
Yeah, we'll see you.
All right. Bye for now.